Mr. Zeda and Sumani Waya were my guests this morning on the show. This has been your show, Wake Up Tamale, on a Friday morning with me, Aye Simon. So,
are suffering from anemia, okay, from various causes, from anemia, from chronic diseases, anemia by virtue of being pregnant, anemia due to the fact that they are young adolescent girls, anemia because they belong to various vulnerable groups, and so this has become an issue of public health concern and needs addressing.
all right. So, what is anemia?
Okay, so anemia is basically a condition. It's a condition in which the number of red blood cells or the hemoglobin concentration is below the normal range for age and sex.
Okay.
We are highlighting the keywords age and sex. So with anemia,
When you say sex, you mean gender?
Gender, exactly.
Okay.
So you can't say you are anemic without considering the age and the sex because it varies with these parameters.
Okay.
So hemoglobin is actually the kind of the carrier molecule for red blood cells. So imagine you have passengers but you don't have a car to carry them to the destination. So there could be red blood cells, but there's no hemoglobin to carry these red blood cells to the tissues.
Okay.
And there are also instances where the red blood cell itself is reduced. So all these two conditions are what contributes to you having anemia.
Okay.
This will be covered.
All right. So, what's the importance of addressing anemia as a public health issue?
Okay, so globally, anemia is a very serious global health issue that's affecting the most vulnerable people in anemia are usually children, adolescents, and then pregnant women. So globally, we have a 40% prevalence in children between 4 months and 59 months. That's around 5 years, 4 months to 5 years. And then we have 37% in pregnant women, and then 30% in girls in their pivotal ages.
Okay.
Yes. So in Ghana specifically.
But it's quite interesting, before you go on with that, it's quite interesting that you mentioned children, you mentioned pregnant women, but you didn't mention the male figure.
Yes, so this has to do with our physiology.
Okay.
So children, you tend to grow fast in childhood,
Okay.
like from a newborn to an adult. The growth spurt is massive.
Okay.
So you need a lot of blood cells to do the maturity with children. So with children, it's not dependent on either a male or a female.
Okay.
All children need this to develop.
Okay.
And then puberty, you see girls, specifically the menstrual period, you lose a lot of blood. So this kind of affects your red blood cell count.
Okay.
So, and then males, on the other hand, don't really go through this menstruation cycle. So it doesn't affect them much in their pivotal ages.
Okay.
And then when we talk about a pregnant woman, you know, the whole process of pregnancy, carrying another human being in your body, your blood cells are going to reduce because the baby will also be using your blood cells. And then during delivery, you lose a lot of blood, postpartum. So all this is what is affecting this particular group of people.
Okay.
And that's why the male is not really affected so much in
right.
this. So in Ghana, the prevalence of anemia is quite high. So it's 34.4% in somewhere around a certain Takrade. And then in TTH, we recorded a 50.8%, and then 56.6% in the Ashanti region. So in Tamale here, that means there's quite a rise in the anemia prevalence in Tamale here.
Okay.
So this is a very worrisome issue, and I think it needs address.
All right. All right, Mr. In addition to that.
I think she's exhausted almost everything already. So
Okay. All right. So let's talk about the causes and the risk factors of anemia, as you've indicated in children and in women or ladies.
okay, so
No figure.
the simplest form of anemia is what we refer to as iron deficiency anemia. It is actually as a result of a nutritional deficiency of iron and sometimes other vitamins such as vitamin B12 and folate. And so an individual that is not receiving these vitamins or molecules in the right quantities might result in component of red blood cells.
Okay.
And so reduced levels of iron in your diet among vegans and vegetarians, for example, who have low iron intake as a result of the nature of their diet, and can cause iron deficiency anemia. Other anemias might be from a result of chronic diseases, like chronic kidney diseases, like sickle cell diseases, like thalassemia, rheumatoid arthritis. Some of these diseases are inflammatory in nature, and then they also may result in blood loss as well. Another cause of anemia, which is actually very common, is pregnancy. Just explaining that in great detail. During pregnancy, there is an increase in the mother's blood. The intention is to help supply the fetus, the growing fetus, with enough blood for its maturation. And then during birth, and even intermittently, in the course of pregnancy, the pregnant woman loses blood. And then again, all of these factors are what result in the increase in iron demand, or even the demand for formation of red blood cells in the pregnant woman, and they suffer anemia the most.
All right. Adams is a woman. She's a mother, and she's going through that state. Probably she'll have quite an important question she would like to ask.
This is the point where the mother receives medical advice from various health professionals, from the midwife, from the pharmacist, from the specialist, the gynecologist, the obstetrician. And so in there, they are able to guide you as to, even the dietitian, exactly, they are able to guide you as to what foods to eat, as to what measures and steps to take to make sure that your blood, your blood health is okay, and then any other significantly sickle cell disease, and then thalassemia. These are also blood diseases. In some patients, by virtue of their genetics, they are unable to form the unit of blood that's responsible for carrying blood to tissues effectively. So the blood cells that are formed become sickle shaped. You know what a sickle is? It's exactly how the blood cells of patients with sickle cell disease appear, and they look sickle shaped. Now they're unable to carry enough blood because of the nature of the shape of their red blood cells. Okay. And so these patients suffer anemia because they can't carry oxygen to tissues that need them.
I was told my blood pressure was running high. Does it tally, or does it have something to do with one another, blood pressure and
Hypertension cannot cause anemia. There's not been any link to how hypertension causes anemia, but anemia can cause hypertension. The intent of your heart pumping is to send red blood cells to tissues and supply them with oxygen to your brain, to your skin, wherever it is. But when you have anemia, that means your red blood cells are reduced. The heart is pumping blood to these tissues, okay? But then because you don't have enough cells to convey oxygen to these tissues, your tissues are recording low oxygen, and the heart is thinking it's not doing enough job. So the heart has to pump even more blood with the intention of supplying more oxygen, which is still futile. So you have your heart overworking, and that will result in hypertension. Yes.
That's quite interesting. So the low level of anemia in your system can foster hypertension.
Exactly.
Okay. That's pretty interesting. Let's talk about the symptoms.
So these are things you should take note of. So fatigue, you easily get tired. So assuming you used to walk from downstairs to upstairs without getting, the time will come when you do something small, you tend to get tired and you feel dizzy. Dizziness is also a symptom of anemia. Headache, you'll be getting headaches without any, once in a while, always get headaches. And then palpitations, like your heart tends to beat faster than normal. And then we also have exertional dyspnea. So you find it difficult to breathe, especially when you are doing something, you do something small and then you are finding it difficult to breathe. And then also pallor. With pallor, if you are not really versed, you wouldn't know. That's like your sclera in your eye, it becomes very white. So that's a symptom. You look pale. So someone will just see you and you are looking so pale, your eyes are looking so white. They say you are anemic. And then so basically these are some of the symptoms you see when you are anemic.
Okay. Alright, Mr.
Yeah, so I'll touch on the things she's mentioned, ends up marring the quality of life of the individual.
Okay.
And that ends up reducing the productivity and eventually perpetuating the poverty cycle. Because once you're experiencing all of these things, you are pretty much incapacitated, and then your work output is reduced.
So it will affect us as a country, globally too. It's affected.
Okay, so let's conclude on the prevention and management of anemia.
So with the prevention, I think one of the basic ways to prevent anemia is the education, she said. And then education is, I think it should start from the pregnant woman, because she will go for the ANC visits and the antenatal visits. So the whole childbearing process is what brings the human being. So education, so we should enforce on that. We should try, as pregnant women, try to always take your ANC and antenatal visits very seriously. There are lots of women that will go to the traditional birth attendants and they don't really take these visits necessary unless they are finding maybe there is a complication. That's when they tend to go to the hospital. But we should advise our pregnant women do well to visit the clinic regularly. Your ANC visits, your antenatal visits. So this is a very key point.
For pregnant women in particular, it's very important to have their anemia managed or prevent themselves from acquiring in the first place, because it has very dire consequences on the fetus. Okay, it can result in a developmental delay, both physical and cognitive. And so it is very important. First thing to check is your diet. You have to make sure your diet is rich in red meats, poultry, eggs, seafoods, legumes like beans and peas, green leafy vegetables. These are foods that are very rich in iron, and iron is required in the formation of your red blood cells. Yes. And so I think that's the reason vegans are actually at higher risk of having anemia, because they stay away from these foods and all that.
All right, so that's interesting how, even though it can be corrected, we know of certain diseases that as soon as it's corrected from birth, it stays that way. But with these, even though it can be corrected from birth, over time you can still apply it. So it's important that as an individual we take very good care of our diet, right?
Yes.
Is there a main formation of anemia or prevention, dieting?
Yes, it's one of the major ways of preventing anemia.
Right.
No, these days we are into polished foods and all that, and that's one problem too. When you stick to whole grains like wheat,
cereals,
exactly,
rice,
they are rich in iron, but the polished ones are not rich in iron, and so you stick to that diet, you're likely going to run low.
All right, ladies and gentlemen, thank you very much for your time this morning. And we hope to get to more often for quite interesting, educative, health-related discussions on the network. Mr. Zeda and Sumani Wider were my guests this morning on the show. This has been your show, Wake Up Tamale, on a Friday morning with me, Aye.
So this whole initiative was brought about by a public health education student society for the UDS campus. So I happen to be part of that society. So today we're talking on anemia, and I was invited to be one of the panelists. The discussion went on well, and I'm hoping that we all learn about anemia and do well to prevent it as much as possible. Thank you so much for sticking here. Bye.